For this week's discussion question, we were asked to discuss a neurological condition. So I'm going to be talking about strokes and TIAs. So a stroke, what is it? It's the inability of oxygen-rich blood to reach the brain due to a blockage or bleeding in a vessel. And then a TIA is a transient ischemic attack. So it's basically a mini stroke, and TIAs are often an early warning sign that a person is at risk for a stroke. It's very common that a person who experiences a TIA goes on to experience a subsequent stroke, so they are to be taken very seriously, and a person who experiences a TIA should seek medical attention. So again, with strokes, there are different types. So an ischemic stroke, which is the first type, this one is caused by blockage. So it's a narrowing of blood vessels in the brain that leads to blood clotting, blockage, and severely reduced blood flow to the brain, also known as ischemia. And then how this occurs, typically an embolus leaves another part of the body and travels to the brain. Then a thrombus forms from atherosclerosis in the brain. And then the second type is a hemorrhagic stroke. So that is the one that's caused by bleeding. So a broken blood vessel in the brain causes bleeding, and then swelling occurs because of that blood accumulation. How does a hemorrhagic stroke occur? The number one cause is an aneurysm. Other causes are trauma, uncontrolled hypertension, and old age. For symptoms of a stroke, altered level of consciousness, headache, facial drooping, one-sided weakness/paralysis, respiratory distress, speech and visual problems, nausea and vomiting, vertigo, unequal pupils, trouble swallowing, seizures, bladder and bowel incontinence, and fluctuating blood pressure. To remember some of those symptoms to look out for with a stroke, you can use the FAST. So F stands for facial drooping. You can ask the patient to smile. If you notice any drooping on one side or the other, that's a sign. The A is for arms. Ask the patient to raise their arms. And then S is for speech. Have them repeat a simple phrase, and if they're unable to, have difficulty with that, then you know those are clear signs of a person experiencing the symptoms of a stroke. And then the T stands for time to call 911 if those are if the person is exhibiting those signs. So in order to diagnose a stroke, a CT scan is performed, and the key to remember here is that if the stroke is hemorrhagic or caused by bleeding, the patient is not a candidate for TPA. Now, TPA, what that means, it stands for tissue plasminogen activator, and it's a protein involved in the breakdown of blood clots. So it's used for ischemic because in this kind of stroke, we need something to break down that blockage. So there are certain criteria that a patient must meet to be able to get the TPA. So they must have negative hemorrhage. There can't be any bleeding. They have to monitor some of their, they have to get blood work done. Their blood pressure must be controlled. So they have to monitor their INR, glucose, and platelets. And then they must not have had any anticoagulants recently. And again, this medication is a clot buster, so the nurse and medical team must make sure to monitor for bleeding, monitor the H&H, clotting factors, and then increase the head of the bed with head midline to increase the perfusion. And then it's also important to not put in any new IVs or injections with somebody receiving TPA. So interventions for nurses would be to maintain the patient NPO until a swallow test is performed to see if the gag reflex is absent or decreased, and then obtain baseline neural data. This can be done with the NIH stroke scale. Fluid and electrolyte balance is also important, and then maintain the airway, so remove any dentures if the patient has dentures. Monitor the pulse oximetry, intubate if needed, and also monitor vitals. And then IV with normal saline can be used to maintain or increase blood pressure. And preventing hypothermia is also important because this will cause vasodilation and increased intracranial pressure. And then you can use aspirin for that. Also, a person who experiences a stroke is at risk of a seizure within 24 hours. So also it's important that if the patient is not a candidate for TPA, they can have surgery to remove hematomas. So that's just kind of a quick overview on strokes and TIAs. Hopefully this helped.